Imagine this. You have a heart condition and you have the choice of two providers. Provider one is a cardiac surgeon who will see you in person, take full diagnostic medical records, and will continue to follow up with your treatment in office visits. Or option two, a company will choose your provider. That might be a cardiologist or could be just a general surgeon. Who really knows? Then you'll have to take your own medical records and all of your follow-ups will be virtual. It's pretty obvious which provider I would choose, and I think it is for anybody. This is the same scenario for patients who are choosing orthodontic treatment. Patients seeking orthodontic treatment should only ever see a specialized orthodontist because of their training, their diagnostic records, and their ability to follow treatment monitoring. Hi, my name is Laura Wright, and over the past few years, I've seen an increasing number of patients coming into the clinic wanting their bites or teeth fixed or completed because they've used these consumer direct companies like Smile Direct Club or Bite. Even the American Association for Orthodontists posts that there is a consumer warning for patients using these consumer direct products and companies. Today I will discuss why consumer direct companies should not be allowed to treat orthodontic patients. These companies do not have the specialized training, the capability to acquire diagnostic records, or provide adequate treatment monitoring. So why is this such a problem with consumer direct companies treating orthodontic patients? It's basically the training. Orthodontic specialists, according to Dr. David Hundle, they go to dental school, they go through college, they are also going through an orthodontic specialty program. This program also requires a residency. Orthodontists are trained for over 10 years for their specialty. And this is why myself and anyone I know, I would recommend an orthodontist to. With consumer direct companies, these dental providers can be anyone regardless of specialty. You can have a general dentist, someone in endodontics that does root canals, and maybe, if you're lucky, get an orthodontist. But that orthodontist is being paid per patient every month for who they sign off on. Diagnostic records are another factor of why these companies should not work. Orthodontists, we take detailed diagnostic records that include full photos, CBCT, 3D x-rays, 2D radiographs, models of patients' teeth, to see a patient in the full aspect, not just the surface. According to the Smile Direct website, consumer direct aligners, it's pretty DIY, okay? The consumer takes photos of their own teeth, so selfies. They also use a mail-delivered impression kit where they take models of their teeth and then mail it off to the company. Very DIY braces type thing, or clear aligners. And really, all those records are doing are getting the surface. They are not seeing the underlying oral structures here. The third reason these companies are such a danger is treatment monitoring. Orthodontist specialists monitor treatment every 6 to 8 weeks. Patients come in for visits, tooth movement is monitored, root placement, as well as any hygiene issues or bite correlations that need to be adjusted. Those can be adjusted right then and there, and the course can be changed. With consumer direct companies, their treatment monitoring, or lack thereof, according to David Bexley with the ADA, is that it does not require in-office visits at all, and everything is performed remotely as needed. So, how can we stop these consumer direct companies from treating orthodontic patients? The ADA, which is the American Dental Association, and the AAO, the American Association for Orthodontics, can place sanctions on these companies, requiring them to complete diagnostic records on these patients before active tooth movement is started, not their current DIY process. There should also be complete transparency with consumers, revealing that these companies are moving teeth blindly and that no underlying dental condition is being addressed. And lastly, the dental community is vital in this. Dental community needs to provide more education to patients about the dangers of using companies like this. So one thing for me is, what happens if these companies are allowed to continue at their current operation? Well, without pressure from the dental community, these companies will continue to put patients' oral health in jeopardy. Orthodontists will continue to see patients with subpar treatment, or what's worse is irreversible damage that they have caused. The popularity of these DIY consumers, it's growing, and we will continue to see it grow because of its convenience as well as its affordability. But these patients are in jeopardy. So in conclusion, orthodontics should be the only choice for orthodontic care. Consumer direct companies have no place in your oral health community as far as moving your teeth, and they don't have your interest in mind. It's very hands-off. And for me, health, dental is all hands-on. So let's stop putting our orthodontics in treatment hands of cold companies that are only interested in the bottom dollar. We would never consider this sort of treatment for anything else of our health, so let's not do it for our smiles. Thank you.